Welcome to the Paindora podcast. I am Dr. Katie and I'm joined by Dr. Kevin. And of course, we love to bring you different types of topics to discuss. And of course, it incorporates pain or challenges in some way, hence Paindora podcast. But ultimately, we like to bring people hope and a little bit of maybe inspiration, but also information to give you a better perspective on how to look at some of these challenges we have within medicine or with our own health. And I'm sure Dr. Kevin would agree that we really, truly want to bring you this type of information that can help you make better choices for yourself or those that you care and are around you. And welcome, Dr. Kevin. I haven't talked to you in a couple weeks. I'm glad we're doing this again.
It has been a couple of weeks. Yeah, we were good
know.
for a while, and then these holiday things kind of kick in since we're recording this right in the middle of the holiday season.
Of course. Well, there was a couple things we were going to talk about today, but I thought it was, sometimes we just run into certain conversations during the day and our work or our discussions with people. And one in particular, we just started tapping into, we decided we're just going to record this, as a gastroenterologist that I worked with today. I had a lot of teenagers, and we started seeing these patterns that run in society that have, they have certain types of diagnoses and medications, and they're going through all these interventions that tend to be more invasive to try to figure out, of course, in a gastroenterologist, obviously see a lot of abdominal pain. And I'll give my 2 cents on kind of the situation that I see a lot, and that is there's a lot of people taking pills for symptoms, and a very big trend has been, the ADHD, which that could be a whole other topic of attention deficit and hyperactivity disorder or attention deficit. There's a tendency to take certain kinds of medications that are like amphetamines or uppers and to get more focus. And there tends to be a lot of children being put on these really early on in life. And what I found interesting throughout this conversation with the GI doctor today is that she recognized in people she's close to that they were being put on a lot of medications for depression, anxiety, and this attention deficit, and they're having abdominal pain. And it took a long time for her and this person she cared about to unravel all of this and deal with more of the root cause. And it takes a lot of patience and belief that there are ways that you can help yourself without always, throwing that pill in your mouth. And of course, these particular individuals, from her personal experience, she recognized, despite her traditional training, that people can get better without all these diagnoses that really don't help you understand what's going on, and really getting away from some of these medications that could have potential horrible side effects. But any thoughts on that, Dr. Kevin?
Well, hearing that, and not to be the super negative one, I go, how many kids were on the schedule then?
Well, my particular room, I had 4.
Okay.
And almost all of them.
Well, so, and this is the reason I'm asking it, is this is also prototypical of healthcare, is you have somebody who says, oh yeah, and my friends and family, I'm recognizing this is so much bigger or whatever, but then in their common practice, they're scoping everybody rather than putting them through a prehab program. And now granted, I understand the concept why there's no incentive to do the right thing in medicine. There's none. And it is much easier to do these, when they're putting a tube down your mouth and they're putting a tube up your rectum, in kids that are young, and these are not risk-free procedures, but the incentive is to do all this crap, reinforce this idea that something is horribly wrong with them, and then after they say, oh, nothing, actually, I shouldn't say that. A lot of times they'll say, well, we didn't see anything, or we actually saw a small ulcer. And then you tell someone in a vulnerable population that, and it's like, holy crap, I've got ulcers, I'm gonna be doomed. But I mean, there's just so much there, because we have this society that is essentially stressed out, and people are, oh, my problems aren't due to stress. I don't care who you are, stress is going to have an effect on you, mentally, physically, everything. A stress response in your body is not simply related to your brain. If you see a tiger, whether the tiger's real or not, if you believe the tiger's real, you're going to have a physiological response there. And rather than like not believing that, or not really encouraging and understanding how that relates to the physicalness of these symptoms, we reinforce them. And then once we put them through the ringer, they have the scope, they have everything else. We put them on the Ritalins and the, what's the other one that's really popular? Which are basically amphetamines, just like you said. And then when it's all said and done, then we maybe will say, let's address the root issue here. You're stressed out, you're pushed too hard, you have 42 classes, you have 16 hours of homework every day, and your parents are telling you have to get 1,600 on the ACT or SAT. I mean, it just drives me crazy. It just drives me crazy.
Yeah. Yeah, the GI doctor I spoke with actually has really looked outside of her traditional training because of her experience, and looked at some of the, looked at the Institute for Functional Medicine to look at some of the ways they go about looking at nutrition and lifestyle factors, and how to help with that. And of course, she knows that, these are things that, it's really hard to get paid as a clinician for some of these, the time spent and all the necessary things to really radically, change your life and really help the patient believe that they can change these things. And it's hard for them to make that connection. It's kind of like you talk about pain. There's multiple things that can impact your pain, and there's when it comes to abdominal pain, it's really no different. Stress and lack of sleep, and that was something that she was noticing too on some of these children, that they're watching or playing these they're gamers, and they're playing till like 2 a.m, and they have to get up early for school, and they're not understanding the consequences of their actions. And so she was just, everything is starting to make sense to her. But it's the same dilemma that we have with trying to reach people out there to help them understand the things they can do to change their situation. And it's remarkable the lengths that people go through to try to fix something and not recognize that they have the power within themselves to change it. But I was trying to think of some of the things you were saying about how everything's connected, and how your stress and emotions can affect, physically, can manifest physically. And, even something as simple as your feelings or thoughts or the stress, when someone's embarrassed, like you can physically manifest,
Mm-hmm.
You can get flushed, red across the chest, or, on your face. And there's so many ways that you can manifest physically from thoughts, emotions, stress, and all of these things together, that, people have to realize that is truly a possibility, that there's other things.
Well, we look at this, the words that we use, and you have a horrible, awful situation. You hear something bad happen to a friend. Oh my God, I have a pit in my stomach. Now, where does that language come from?
Mm-hmm.
Or this, people think love's in their heart, or they feel that warmthness in there. It's just, you cannot separate the two. And the key thing, I think, for anybody to understand is it's not either or. It's not either physical or it's emotional or it's stress or I have something real in me. It's all real. What the question then becomes is, where is what I call the primary contributor? And if the primary contributor is the symptoms, and the symptoms, what are symptoms? Symptoms are things that are subjective, meaning that they're unique to you. They're when you have, like when you're saying, oh, I have pain. Pain is this expression, or it's a construction in your brain that's telling you this stuff. But that is an experience that you're having. And so when the experience is the primary contributor that you are treating, how we treat that is very different than, say, you have a broken leg. And if you have a broken leg, we want to make sure the leg is put together. And we're going to talk about the pain, and we're going to talk about anything else. But the focus of care is on that primary contributor, whether or not you have pain. But if you have horrible leg pain, or if you have this stress and you have horrible anxiety and your stomach feels tight and in knots all the time, it doesn't make sense to go chop your stomach out when you may be having this experience or these symptoms there, but it doesn't make sense to go down there and chop it out simply because we could do that.
Right.
but it's ignoring the fundamental issues. It's ignoring this thing up here. And, like what you were saying though, the innate capability of the body and brain to heal is profound. And we've done a crappily poor job of it in healthcare. We've diseasified it, told people they're pathetic, they're broken, that you need every pill or supplement on TV because we just don't have the capacity to heal. And it's nonsense. The body is so much more strong and resilient than people give it credit for.
Yeah. Yeah. There's, I was thinking about, in particular, a patient that, I mean, just the lack of understanding of how the body works, and just generally speaking, is so prevalent. And of course, I think we sometimes take for granted, us in the medical field, this becomes kind of part of our like common knowledge, and so we would assume that sometimes people would, understand some basic concepts. But even just one of the teenagers wasn't fully prepped and still didn't have a clean colon for doing the colonoscopy, and it was very clear that this patient is backed up, and there's just, he's very constipated, and so by golly, there's going to be some problems and difficulties, possibly bloating, gas, pain, some bleeding because you're trying to force things out, so
ruptured bowel.
Yeah, I mean, there's all kinds of stuff you can create with that, and younger kids don't conceptually get the whole diet and the importance of real food, not things that come out of some factory that you don't even recognize any of the ingredients, so just that in and of itself. And then I was stuck with a situation where someone who is of the mental capacity, maybe not able to focus, but mental capacity to be able to receive an IV, is wanting to, be masked down, to have the IV. And I fought that, and I didn't fight it in their eyes. I just said, well,
have they had that before?
I don't know. Didn't go into that depth.
But because when I hear that, I'm like, you have to have an idea that that's even a possibility to even ask for it, which means I'm like,
I think the nurse said it.
Oh,
or the mom.
I was like, how many procedures have you done that that's even a possibility, even though we do it in like 4-year-olds? But
right. Well, you have to understand, this is a bigger, little bit, fluffier person. So I just immediately said, in my opinion, that is going to be more uncomfortable and more challenging because it takes a longer time to get you asleep than someone who's like a little baby. It doesn't take very long. And I said, if you need to, focus on the TV and distract yourself, I think it's really important to get the IV. The great thing about the IV is that once you have it, it's a very smooth and quick way to go to sleep. And as soon as we're done, you just, you wake up and within minutes, and it's easy peasy. But you have to create the structure of like the amount of pain or risk involved, even though they just want the easy out and not have to deal with some discomfort. And that's, to me, I was seeing that was a big problem, a heightened anxiety, heightened concern, heightened sense of need to protect himself or herself. And so there was a lot of redirecting and reframing it. Otherwise, they were going to jerk and move away and cause more problems, trying to show that they don't like it. So it's really interesting having to read people and interpret them, but it's so much easier when you just see them as, how vigilant are they? Are they hyper vigilant? And are they looking like they're in the sympathetic, bright-eyed looking, and they need to protect themselves? And the energy they give off, I mean, you can almost palpate it. You can like feel that. And so you can't go into that with intensity, or they're going to fight you and you'll make it worse. So it's interesting how you have to weave into that situation. And we ended up getting an IV. And so it made things simpler, but you see this tendency of people that are really hyper vigilant and really concerned, and pain. Like, I can't tell you a precise study on that, but you tend to see they have a heightened response to painful stimulus.
Well, and you can also, what you can say is people with persistent pain typically have many other comorbidities. And I'm going to use the word physical, although I hate that word because we're somehow distinguishing the two. But they have multiple comorbidities, and it makes perfect sense. Again, just like you were talking about when you're looking at how they see the world. And so when we're looking at things like past trauma, early life stressors, and if your brain is subjected to that, and the brain's job is to try to make sense of the world in order to keep you alive, that's its primary point of existence. It's going to adapt, and it's going to see threat easier than brains that weren't in that environment. So if you were in an abusive relationship, or you were abused as a child, or you were in a neglectful household, or you had horrible, awful things occur, that doesn't mean you're crazy, doesn't mean you're faking it, doesn't mean anything other than the fact that your brain's trying to protect you. And when it's being very aggressive about that and it's seeing threats so easy, again, it's not either or, it's and. There's going to be physical symptoms with it. And so I think one of the importance about emphasizing appreciating that, whether you have a broken bone or whatever, is the fact of the matter, if you learn the skills and you understand why your brain's trying to do it, you decrease the fear associated with these symptoms that are vague and uncertain, and understand basically some education about how the body works, framed in such a way that it's positive rather than you're broken, damaged, and however else what we should, people can get better. And then the nice thing about that is when you start talking about resiliency and understanding pain, and you start talking about stress and how we globally calm the stuff down, the side effects, like a drug, you take a drug and it's like, I'm taking this for this. And what's the side effects? Headache, nausea, blurred vision, dizziness, whatever. The side effects of what we're talking about, which is basically understanding and awareness, stress mastery skills, resiliency, and reducing uncertainty, is not only decreasing the symptoms and pain, is actually tend to see the physical manifestations go down as well. Mm-hmm. So it just is, the more you learn and understand this stuff, the more you just get, well, if you're me, the more you get frustrated at just how bad we do about taking care of people. I mean, right. It's just unbelievable.
Yeah. It's interesting because perfect example, a lot of examples today, and in another patient, and how well, first of all, I recognize that all three other siblings, 3 or 4, irregardless, it happens in multiple situations where they all have ADHD. They all are probably on same medication. And then you recognize you think about, you're talking about genetics versus, your environment. And one thing that, some people use the analogy or metaphor of the loaded gun is kind of like the genetics, and usually
that's so threatening.
It does sound threatening, doesn't it? So we need to find a different one.
I would call that, you have, if you have a pot, there's cracks in the pot, right? If you craft a pot and then you fire it, there's some imperfections in there that make it what it is.
Right.
But it doesn't mean that this, it's not
going to crack open.
Yeah.
Yeah. So, I mean, you can have this genetic potential, and your environment and your life and how you live your life can unveil that genetic potential. And so, given, the fact that stressful childhood events, can make you more predisposed to chronic pain and other issues and illnesses. It's interesting around the nurturing aspect. When one of these children have a parent, when I'm speaking to a child or a teenager, and I sense and see in my peripheral vision the reactions of a parent, and in kind of like this, like, everything I'm saying, like, it's like a big deal. I'm like, and I'm thinking the imprinting on a child, and the concern and level of vigilance and need for protection is being conveyed from a parent. And people don't realize that, even if you don't show it, which I could definitively feel from seeing it, there's also a sense the child can feel that, these intangibles, based on how they know that parent and whatnot. So, so this is like a perpetual kind of perpetuate this issue of protection, because of course a mother or father's, there is a certain innate desire to protect them and keep them safe, but if you want to have some resilience within your child, there also has to be a belief that they can handle this, and you need to empower, and it's easier said than done, but there has to be some point where you can let them feel like they're in a safe place. Otherwise, this person was apparently crying before I got there, and I try to find every which way I could to make them feel safe, because I do feel like it impacts, even the anesthesia and their nervous system while they're asleep. So people don't realize that.
Yeah.
Yeah, I think that this topic, we don't really talk about abdominal pain in the last few times, but I think it's that perfect situation where in these cases they didn't find anything, like nothing that was significant other than functional, like constipation,
well,
and this
and that's the likelihood that it was going to be, right?
Mm-hmm.
Especially in these young kids.
Right.
And that brings up the whole topic of functional gastrointestinal disorders, which is absolutely fascinating, because if you read the literature on functional gastrointestinal disorders, you can replace that big long name, functional GID, with pain. It's the exact same thing. Mm-hmm. And so if we're talking about like genetic vulnerabilities or risks, I kind of look at it this way as, okay, what genes just provide a basic vulnerability. It's not destiny in any way, shape, or form, but it's how you're going to express it. How is when you are under significant distress, what's the triggering agent that your body's going to use to inform you? For some people, pain is pretty universal. Other people, it's things like functional GI disorders. Other people, it could be things like palpitations. Other people, it would be shortness of breath, headaches. For some of us, it's insomnia. So that's the one that I picked up was, and I think, looking back on it, my grandmother had insomnia. So maybe there was a genetic predisposition to that, and that's how we arise. But it's just becoming aware of that. And then you touched on the thing of basically of helicoptering. And here I am saying, well, the medical system diseasifies the health of everybody and tells everybody that they're vulnerable. Unfortunately, by trying to do our best as parents to protect our children, we're basically telling them that they're weak and vulnerable, and we're not giving them the space in order for them to grow and develop. It's like there's this analogy, and I don't remember if I heard this somewhere or what, but it's like, if we treated kids from the time they were born, like how we helicopter them once they're like conscious and talking, nobody would walk. Because as soon as the baby was trying to get up and fell down once, we'd be like, don't try that again. You might fall down and hit your head or skin your knee. But we don't do that. But on the same time, if the baby's trying to as the top of the stairs and is trying to walk, we're going to grab them, because your job as a parent is to measure the risk. Is this going to be a fall that they're going to learn from, and they're going to learn some skill sets in order to pull themselves up it? Or is this really the catastrophic thing where if they do something, they're going to fall down 6 flights of stairs? You stop them when they're at the 6 flights of stairs, but when there's other things that's important learning, we do. And it's now, granted, it's hard to do as a parent. I'm a parent. I have 2 kids. I love them to death. And the ability to step back and actually let them to fail, you have to be conscious and say, in this situation, what are the downsides? Skin, knee, hurt feelings, or whatever. It's better for them to learn that now, while I am here to carry them through the process and recover, than to not develop those skills, leave the house, and now what are they going to do? Then they go to college, and there's this epidemic in college where these kids have no emotional regulation. They have no skills. They can't cope with high stress environments because they've never had to do it before.
Right. And stress is not any easier. Like, it's the worst.
It's worse. Yeah, I'd say it's worse. And it's like anything that, like health and all this stuff, it's a process of learning. And those baby steps we take are called baby steps because those are the little challenges. Now, if the baby, again, never learned to walk, and then all of a sudden we kicked him out of the house at 18 and said, you got to go, run a marathon and work in the fields or whatever, absolutely no coping strategy. We have to do all that early development again for them, or at least put them in an environment where they can start learning. That's super challenging. So you're basically setting them up to have a much more challenging life by trying to protect them so much in such an early age, or feeding into this, when you see multiple family members on the same set of, and particularly things like ADHD medications, that always sends up some red flags for me.
Mhm.
It's not to say is people, oh, ADHD is not a real thing. No, ADHD is a real thing, but there's a spectrum from all of this stuff. And I guarantee you, we have actually published data on this, that we are way, 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 way overdiagnosing this and over medicating kids.
Yeah. Yeah. No, that's, you know, it's, I said something about, you know, this idea about the world is more stressful, but I guess it's all relative because those that are more resilient don't find the things that are what seem to be more stressful as stressful, and the people that are not resilient, they're probably just as stressed someone who has way more going on. They're more stressed with something smaller, when you look at the grand scheme of different stresses. So I mean, it's all subjective. But yeah, no, I think that there's it's hard. You don't want to shame parents, but it has to start from, you know, what we're providing. It's just like anything in the pain world. You know, if you're just giving them something, like diagnosing and giving them a strong conviction that there's nothing else they can do other than take this pill, then they buy into that and they do that, then where's the incentive, you know, to go do other things? If you're, I mean, if you're not motivated to do anything else, then you become dependent on that, and then, you know, potential for withdrawal from that. I mean, there's so many other complexities that come along with it. But you know, I wanted to bring this topic up because it's so prevalent. I mean, there's there's kids left and right that are on medications, and I even told one of the children who happen to be working on coming off of medications, and strongly because of the mother, she actually has gotten sick of the medications. That's, you know, that, I mean, I just said, I'm extreme. That's, you know, I'm very proud of you for coming to those realizations. And, you know, that's something that to make that switch, I think it's really because of the role model and the mother that's guiding them. But if you don't have buy-in from the parent or the physician that's explaining things, doesn't give them some other way of looking at something, then they don't even have a chance unless they just learn, you know, the hard way.
Or like, there's a percentage that gets sick of it and are just done, right?
Right.
And
It may not tell you.
well, they don't tell you, you don't hear about them, and then they just, the thing that's a little bit upsetting for me though is they get sick and done, and in some ways that's a good thing, because then they kind of extricate it from a system that is just like pounding them with pills and procedures and all this crap. But they still have the issue unless they've learned another way.
Right.
They've just decided the medical system's not the nature to it. So how best then can we educate and inform? I like how there was a tagline you said at the very beginning of this: information and inspiration. You know, so how can we do that? And that's kind of the point of this podcast, is just point out there's some ridiculousness here. You're not going to, there's, in the healthcare system itself, there really is a disincentive. It's not like there's this vast conspiracy thing. The incentives are simply not aligned to keep people healthy. They're aligned to do crap to people. That's how it is. And so for you is to recognize that, hey, it's not either you're stressed or you got, you know, some horrible thing going on in your stomach. It's, and your stress is going to affect whatever you have. And so rather than, you know, neglecting that, stress skills are key in understanding resiliency, and becoming comfortable with uncertainty in an uncertain world is also very key. But those are things that you can develop. And if you get those, if you start developing those skill sets and you start passing them down to your kids, they're self-replicating. And the side effects of them, just like we're talking about, affect basically every other organ system in positive, not negative ways.
Right.
So,
yeah, I think, the message for today's podcast is, it's empowering to recognize the capacity you have to help yourself, and to seek out those role models or the leaders, people that understand that there are ways that you can help yourself deal with stress and deal with various types of challenges in life. And I'll end with just the idea that this one of the particular patients, I made a comment with reframing, and just, she was already on her path of recognizing the importance of not relying just on pills. And I just said, humans have been getting along and surviving for centuries and without all these pills. And that's got to tell you something. Like we are a resilient species, and we have the capacity for healing and for improving our lives. And yes, there are hard times and there's some, hang-ups, and we may need help from time to time, but we have way more power in our life than we ever give ourselves credit for.
Absolutely. No, I 100% agree. And that's the whole thing, is how do we encourage and educate people on the bodies and brains are resilient and strong. And if they're feeling weaker at a moment, how do we develop the skill sets to strengthen them? If you have a weak leg, you're not going to, like, again, cut your leg off. It's like, how do we strengthen my leg? How can I lift bigger weights? Am I going to go off and lift 5,000 pounds today? No, but let me start with 5 pounds and let's develop that muscle. Health is like a muscle. You can develop a muscle, and it's just amazing how the capability of the body to heal.
Yeah. Yeah. So, never give up, and just always keep exploring. There's some way somehow that you can help yourself, or find ways to improve your situation. I really believe that in most cases, in almost all cases. Time is also your friend too, but that's something that sometimes takes time to really believe that. Any final thoughts, Dr. Kevin, on our little podcast on gastrointestinal pain and various cultural things?
No, I think that was good. I think we touched on, every time we do this, I'm like, oh, we could talk about this. We could talk about, there's so many nuggets inside the episode that we could just delve deeper in. But I think the key thing one is recognizing stress, recognize all those stressors that your body and your brain are going to tell you when you're stressed. It's not just, and just understanding the capability of the body to heal. That's the biggest thing. This idea that that's been propagated. I don't know if you've talked about pharmaceutical marketing yet, but the idea that somehow every symptom that you have needs a pill, otherwise, well, they never really say otherwise what, I'm not sure, but you need it. It's just a joke. The reality is that we need significantly less of this stuff. You can heal. It's better for you. It's certainly a better investment of your time, energy, and your money, so that you can actually, you're not on expensive medications anymore. So I guess that's why we're here, though, is we do a little bit of inspiration and education and information on, and we'll touch on some of those in future episodes as well.
Right. And I think that our messages will repeat themselves, because it really is a similar theme, but talking in different contexts. But thank you for joining us on this episode of the Paindora podcast with Dr. Kevin and myself, Dr. Katie. And if you have any special topics, there'll be different places where you can make suggestions that maybe you'd like for us to touch on. We'd be happy to touch on those things too. And until next time, as Dr. Kevin says, be well.
Take care, folks.